We're pleased to welcome Dr. Joseph Helms, founder and president of an organization called the Acus Foundation. Good to see you, Doctor.
Thank you very much.
Acus stands for?
Acus is Latin for needle, and therefore it's part of the beginning of acupuncture. And I've been bringing medical acupuncture into the U.S. military for the last 10 years.
That's what the foundation is all about?
That's what the foundation's all about.
Why into the military?
Why into the military? Because the military needs it. We started this, we were invited by the Air Force to start an acupuncture training program during the Iraq-Afghanistan period when there were many damaged soldiers coming back. After 9/11 and the consequences of 9/11. And there were a lot of damage to military service members that came back, both with physical as well as psychological, psychospiritual damage, and weren't being handled in as comprehensive a way as was.
What are they dealing with, Doctor?
They're dealing with physical pain, the traumas of explosions. They're dealing with psychological pain from the trauma of seeing buddies blown up by IEDs. They're dealing with psychospiritual angst of having their lives turned around and not ever being able to find what they left. As well as the more garden variety problems of respiratory problems from the sand and the wind, sleep problems from night missions, fatigue, profound fatigue from never finding a safe place to rest while they're at
acupuncture, and I only because I've tried multiple times for something I'm sure a lot less, migraines, and it has been very helpful to me. But more importantly, to the veterans who are struggling, dealing with a whole range of very complex physical, emotional, psychological issues, how does acupuncture help them?
Acupuncture addresses the problems, both the problems that are presenting, such as the headache, but also the problems behind the problems.
These are much more severe headaches that you're talking about.
Are the headaches coming from stress? Are the headaches coming from sleep disturbances? Are the headaches coming from bad memories?
I was going to say nightmares. I mean, horrific.
So with the acupuncture, we try to address not just the symptoms, but the drivers behind the symptoms. And while it's not a panacea, it doesn't cure everything. It's a very safe and often effective technique that doesn't bring with it the complications of addiction or drug dependency.
What is opioid? I read that what you and your colleagues are doing at the Acus Foundation helps with respect to the opioid addiction crisis. How?
It does not treat the addiction itself. What we do is train the doctors that prescribe those drugs. So we train the doctors that treat the pain, or that address the pain that can and has in the past moved to opioid dependency, because I mean that's the way we were trained. That's the way pain was handled. But if you use the acupuncture as the initial or early intervention for an acute or a chronic pain, you can frequently reduce the need for or eliminate the need for the pharmaceutical component.
That's a big deal.
It's a big deal.
How do you train these physicians?
Well, let's call it our flagship project.
Where's that, out in Nevada?
It's in Nevada, right. It's at the Nellis Air Force Base in Nevada. We have a champion there.
I'm actually taking a look at it as you talk about it. Go ahead.
We have a champion in-house who was the family medicine residency director. He did our acupuncture program independently, went back, was using it a lot in the resident clinic. The residents were excited about it. He asked us to go and show them what we could do, teach them at a weekend. They were enthusiastic enough so that we created a program specifically for them. So it's really the best training opportunity that we have. It's 5 4.5-day sessions spread out over an academic year, where they have both didactic demonstration, hands-on supervision, and practice with patients at each of these sessions.
Why do you do this, Doctor?
Why do I do it?
Yeah.
Because it needs to be done.
Why you?
Why me?
Yeah, I need to understand why you. There are so many other folks who could have done this. You chose to do it.
I've been teaching acupuncture for 40 years. 10 years ago, we were invited to get involved with the military. In the first 5 years of that time, we developed techniques, protocols, and had the experience to confirm that the acupuncture, we call it medical acupuncture because it's a combination of
That's right.
traditional principles and contemporary scientific approaches. We've been able to develop protocols that address, not completely, but fairly convincingly, the pain problems, acute and chronic, the sleep problems, the post-traumatic stress problems, the general stress problems. And we were successfully delivering that to to Air Force and Navy and a few Army physicians between 2008 and 2012, at which point the funding started being slowed down.
Cut, right.
There was,
Where's your funding
not
come
cut.
from now?
The funding now completely comes from the Acus Foundation. It's a 501c3 nonprofit
You have to raise
charitable
money.
organization. We have to raise money.
Yeah,
to
same
do
here,
that.
right?
I'm sorry?
Same here.
Same
That's
here,
what we do,
right.
to be able to do no money, no mission.
Exactly.
You raise money on a regular basis.
We raise money in order to do the training at the Nellis Air Force Base and beyond. We've given programs at other Air Force bases, one day first aid acupuncture. We've taught at several VAs to get them involved in acupuncture, seed planting training, but things that they can walk out and do.
The next 6 months, next month to
but
a year, what happens
the
at the
question you asked
foundation?
is why me?
Yeah, why you?
Because I can do it, and because I could not ethically stop doing it when the money dried up. And when money completely dried up in 2013, 2014, I created the foundation, and that just gave us 1 year of gap between 14 and 15 until we had the money to start at the Nellis Air Force
All
Base.
private money.
All private money.
Dr. Joseph Helms, founder, president, and the passion and conviction behind an organization called the Acus Foundation. And I know that, again, the website has been up, Doctor, and I hope people can find a way to be helpful in the way you and your colleagues, or help you and your colleagues continue to help so many who have the need. Thank you, Doctor.
Thank you. Thank you very much.
We'll be right back right after this.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of Caucus, New Jersey has been provided by the Turrell Fund, the Robert Wood Johnson Foundation, R.W.J. Barnabas Health, Delta Dental of New Jersey Resources, TD Bank, and by the Healthcare Foundation of New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus, New Jersey has been produced in partnership with TriStar Studios.